The World Health Organization basically defines palliative care as an approach that improves quality of life for patients and their families facing problems associated with life-threatening illness through the prevention and relief of suffering by means of early identification of those problems or the disease, impeccable assessments which needs to be continuing, and treatment of pain and other problems that do exist. I think it's really important to understand that life-threatening illness is not just defined as cancer. Most people think of cancer as the life-threatening illness that defines everything, and everything revolves around that. And we initially, when we started in palliative medicine in South Africa, in the very early days, had no support. After that, we actually had support from medical aids, or from some of the medical aids for oncology patients. We're now at a point where not even all the medical aids have palliative benefits in their medical aids. Those that do have, some of them have palliative benefits for oncological as well as non-oncological conditions. But there are some medical aids who are still restricting palliative care basically just to oncology conditions. And then there's a whole host of medical aids who still do not really recognize palliative medicine or the fact that patients might be at end of life and need assistance. It makes it quite difficult, therefore, to actually negotiate this road. I think not only for medical doctors, but also for carers and for families and for patients who, when they get to a point in life where they might need the intervention or help from palliative practices, face huge obstacles in terms of determining how you walk the road, and with the problems associated with it. The approach at the end of the day is a multidisciplinary approach. It's holistic. So when I say multidisciplinary, although we don't in our practice specifically have dietitians or social workers or physios or OTs or speech therapists for that matter, we do have we do have doctors and nurses. We collaborate with all these other auxiliary services and would always be able to offer patients those kind of services as a benefit to try and ameliorate and make things much easier for patients and for families and coordinate care. So it is quite complex, but it's quite simple once you have a system in place and once you understand.